fam, hey guys, welcome back to my channel. Soti here. If you're seeing my face for the first time, hi, hello, my name is Sotonye. You guys already know, but if you don't know, my name is Soti Baby, Soti Mama, Soti Special, and now somebody added Soti Sprinkle. I mean, I'm telling you, I'm waiting for the next one that they're going to add. So with me here today is a very, very special guest, my twinnie in secondary school. Yeah, that's this called twinnie. My friend who is, my special guest today, talking about a very, very interesting topic. And in fact, before I keep going on, let me just allow her introduce herself. Tell us your name, what you do, why you are in this, sexy outfit, and yeah, let's get into the video.
So, hi everyone. My name is Emike Maria Ikimalu.
Do you
understand?
Yeah.
I am actually one of the clinical embryologists here at NISA Prime Fertility Center.
Okay.
Yeah.
Okay. So we'll go into what an embryologist actually is. Okay. I don't believe you even know that word. I've heard that word before. I'm not sure. Okay. Me, I'm very proud that this is my secondary school friend. I'm glad to have her here today. If you have watched the other video, you already know her. So, but if you haven't, stop this video now. Go and click and watch the intro video where we talk about her personal life, ask her a few questions and all of that. But today in this video, we're going to be doing a Q&A. Okay. So we asked her some questions. You guys asked me some questions on Instagram and on YouTube community, and she's going to answer them to the best of her ability. Okay, an embryologist is not a gynecologist or an OBGYN or a surgeon and all of that. So she might not have extensive medical knowledge to some of these issues. So we recommend you click the link in the bio for the website to the hospital and other resources we can provide to answer your questions. But for now, we'll answer the questions that are available
to the
best of her knowledge. Okay. All right. So the first question here is talking about PCOS. Okay. Yeah. PCOS is trendy now.
It's trendy, no?
Yeah.
And actually, we see a lot of it. We actually see a lot of it. It's like, well, like you call it PCOS, right? But we call it PCOS.
Okay, yes, PCOS.
It's called polycystic ovarian syndrome.
Yes.
It's where your ovaries have little sacs of water inside it, and then this can cause some ovulatory problems and all of that. Yeah.
Okay. So the question is saying that one of the questions the lady is asking is that does it mean that when you have PCOS you cannot have children?
No, you can. You can. There are some drugs that they give to help the help the issue.
Yes.
Like help the water, the little sacs of water like drain on itself and everything.
Okay.
But because also it has an effect on your hormones.
Yes.
And there's no way, once you talk about fertility, your hormones
they come into play.
Is very, 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 very important. So in that way, indirectly, it can affect your hormones, therefore affecting ovulation and all of that. Yeah. But it doesn't mean that you can't get pregnant, but it can affect it. Yeah.
Is there any cause of PCOS? Is there anything you can do to prevent having it? Like what actually causes PCOS or PCOS, as we say?
I don't really know, and I don't even know if there's an actual cause, right? Because a lot of people kind of just present with it.
Yes.
Right. Even some young ladies of 20-something, they just present with it sometimes. I don't think maybe you've done something that has caused it.
Yeah.
But then again, you don't know because the drugs some girls nowadays are taking.
So some things may be affected.
Maybe.
Especially since it's hormonal.
Yes.
But generally, you're saying that it might just be naturally occurring.
Yes. It might just naturally occur. Okay. Because your body is your body, and your body can decide to do whatever it
wants to do. Okay, I see. All right. Are there any possible tests you can do, like, to identify? Because I know that the PCOS has multiple symptoms that look like other things.
Yeah.
So like these painful period cramps that you can think it's just normal cramps.
Yeah.
It can be endometriosis. That would be one I don't know how to pronounce. Endometriosis.
Endometriosis. That's separate.
Yes. But is there any what was this question? How can you identify if you have PCOS?
before going to the doctor, you can suspect.
Okay.
Like you said, painful menstruation. Then some people have facial hair.
Yeah, yes, I read about that.
Yes, facial hair and some all those other stuff.
Mm.
But how you can know
Mm.
is through a scan.
Okay, for sure, for sure.
For sure. They will
Okay.
do a scan, a transvaginal scan,
Okay.
where they will look at the ovaries and see what is going on there.
Okay, I see. Okay. Okay. So how can you now manage it? Is there specific medication you should take? And there's exercise, there are diet tips and things like that.
Yeah, I think there are some medications I don't really know.
No, but you shouldn't even be recommended. She's not a doctor again.
Exactly.
So this is just generally, this is PCOS may affect fertility, but it's not a specific fertility issue.
Yeah.
Okay, so I think she'll send us some articles that you can read
on,
for research and all of those things, so that you know what you can do. But from my own personal investigation, I think there are some dietary restrictions.
Yes, and I think there are some drugs as well.
Yes, and some even what did they call it? Exercises too.
Mm-hmm.
Some people were saying some kind of exercise,
lifestyle modification
and all of those kinds of things. Okay, so PCOS. I said PCOS is something that is plaguing a lot of women. So I think that the more we know about it, the more we investigate, the better for us. So I think that covers that topic as much as she can answer and as much as I can. Okay. So the next question is, I would like to know the cure for endometriosis that caused a blockage of tubes. He said his HSG and a series of other tests have been done.
Endometriosis is one kind of funny thing because it's like it's when the inner lining of your womb where a baby is supposed to attach, right? When we see those cells growing in other places of your body. Yes. So to put it in a very funny term, it's like growing teeth in your ear.
Wow.
Something like that.
Wow.
Right?
Wow.
So it's just like, so whenever you chew, you chew from your ear.
Yeah. Oh my gosh.
Right?
Wow.
So that endometriosis, when you bleed from wherever else those tissues are found.
Wow.
So some people, it's in their brain. When they bleed, they can have seizures. Some people, it's in their lungs. When they have their period, they start having all these pulmonary issues.
Yeah.
You know, some people, it could be in the cervix, right? But it's still the same way, it's still the same pathway a period comes out. So it may not give as much symptoms as it will give. So
that's why sometimes the period will be very, very heavy because you are bleeding from many places.
Exactly.
Well, that makes sense.
So this one in the tube now, it's just that the HSG, I'm sure, is what has shown that it's there. Most times is surgery, right? But also, like the person that has in the tube, that surgery now may affect the tubes.
Okay.
Itself.
So it's a very tricky thing.
It's a very tricky thing.
And it might affect conception.
It may, yes.
To definitely affect it.
Yes.
Wow.
Yes. And that means that those cells are growing to the tubes so much that it has even blocked
them. Wow.
You know?
So it's surgery.
Yeah.
There's no medication.
And even that surgery, I think, may still be a bit dicey. But I mean, there's always solutions.
There are always solutions. Come to Nisa Prime, guys, for your solutions. The person also asks, how can she conceive? So this is the same person.
Yeah, so it's IVF.
It's IVF.
That will be
the safest way for her to.
Yeah.
Okay, so IVF. And what's IVF for people who don't know what IVF is?
Okay, so IVF is in vitro fertilization. It's where the egg is removed from the woman, the sperm also is removed from the man, and then they are put together in the lab and for it to fertilize, and then for it to grow into embryos. Then we now put it back into the woman for it to now grow into a baby.
Okay. So will she need a surrogate for this or just regular IVF?
It depends on what the doctor assesses. Yeah.
Okay.
But from what I'm seeing, maybe.
Okay.
But the doctors will need to assess.
Okay. so I hope that answers your question, guys. Again, I just want to keep emphasizing that she's not a
Doctor.
Yes, she's not
Very
a
important.
doctor, but she's doing her best to answer your questions. Okay. Someone said, I would like to know if someone that had a total thyroidectomy can still have kids. I heard thyroid controls the hormonal gland for fertility.
Yes. The thyroid glands are very important for hormones.
Okay.
Right? So if the thyroids have been removed, I suspect that the person's hormones too might be affected, right?
Yes.
So I think they do some sort of hormone therapies.
Yes.
So I don't know if they do it in this country.
Okay.
But IVF will still help, right?
Yes.
Because there's always a way out of things,
Mhm.
unless if you have chosen not to go that route.
Okay.
But there's always a way out.
Okay. So hormone therapy is a possibility.
Yeah.
Then IVF, surrogacy,
Yeah.
and all of those things. So you
Yeah.
you may still be able to have kids.
Yes.
Right?
Yes.
Yeah.
But I mean, the person needs to check her own hormone levels first.
Okay, so see a doctor, please.
Yes.
See a gynecologist, please.
Mhm.
Okay. What causes increase in thyroid and prolactin levels in the body? Do you know this?
I don't know for sure, but what I keep saying is that when it comes to hormones, your body can just do whatever it wants to do, right? But I know that high prolactin is what is that's the hormone responsible for breast milk.
Yes.
So if it's high,
Yes.
yes, it may affect. I've seen people that have
Mm-hmm.
high prolactin and it affects, but there are drugs you can take that will bring the prolactin down. And then,
Why would you have, if you're not pregnant, why would your prolactin levels be high?
Because all these things are controlled from your brain,
Okay.
right? So sometimes it could even be overweight. Sometimes if you're overweight, obesity can affect your hormones.
Okay.
Your prolactin can be high.
Yeah.
All that.
Okay, that's part of
Yeah.
it too. Okay, so
Can
diet, health,
Yeah.
and some other factors too. Okay.
And also it can just happen.
It can just happen. Okay, all right. What to do concerning irregular periods and also hormonal imbalances in the body, and what a single lady should. Okay, let's just ask the question one by one because this lady asked a lot of questions. Okay, so my question is what to do concerning irregular periods and hormonal imbalance. So we kind of touched about that, hormone therapy.
Yeah, but then again, another thing with hormones that we need to know is that it's very, very much affected by weight. Yes, because imagine hormones, it has to travel from your brain down. So if you're having so much fat, fat has a way of sucking up your hormones, right?
Okay.
So it can also be something that can be addressed by lifestyle modification. I can tell you personally that if you drop in kg, the difference would be very,
very
clear. Even just someone that is obese, right? Just drop like 5 kg, right? Especially if you're obese and you're having all these irregular periods, just drop a few pounds, you'll see the difference.
Everything will regularize.
But it can be also be caused by other stuff. I'm just giving you an example.
So okay. So even the PCOS might be causing it too. Doesn't mean you have that, or the endometriosis and all of those things. So there are many reasons for. Well, how about irregular periods? Are people just born with irregular periods, or Because I used to have irregular periods as a kid, and then it now normalized. All of a sudden, it's standard. I don't miss
hormones, man. They do what they want to do. Last.
They
do what they want to do last because it starts from your brain. Anything hormone starts from your brain.
But I also want to say from personal experiences how irregular is the irregular.
That too.
Okay, that's another thing we need to be talking about because it can be regular by this month is 8 days, next month is like how many days or whatever.
10 days or
exactly.
That's
not so bad, that's nothing. But the one that you might skip a whole month or 2 months.
Yes, or maybe when it comes for 2 days.
Yes, exactly. That's when you now say is irregular, and then you have to please see and to make sure that it's not one of these things that we've already previously discussed. Okay, what can a single lady do to increase fertility before getting married?
Just live healthy. If you ask me, that's because I'm not. There are some multivitamins and all those things
That people
take,
prescribe, yeah.
which is fine,
Yes.
but check your lifestyle first.
Mm.
You may be doing something, you may be eating the wrong things,
Mhm.
you may just be.
You might even be slim. Oh. This thing is not
Yeah.
just, it's not just about
It's
fat.
not just
and
about
everything,
fat, yeah. Underweight, you
Yeah.
need underweight too.
Yes.
Mhm.
Or being sedentary, like you're sitting down all the time in the
Exactly.
office. You know, at 9 to 5 sometimes, you find out that 4 hours later you've not stood up
I'm
one
telling
second.
you, I have smartwatch that used to remind
When
me,
you
stand up.
Yeah.
Once I stand up, I'm going from office to office to look for trouble.
Yeah,
If I don't have work to do.
Yeah. That's it too. That's possible.
Yeah,
But
so
somebody, let me ask you, somebody, in fact, a lot of people swear by evening primrose oil. And they say that, oh, if you take it, that it helps boost energy and skin. Because
that
actually for
is
skin,
vitamin E.
yeah, sort of, but that it
Evening
also,
primrose.
yes, but it's fertility. Do you agree? A lot of people have actually smoked by it. Somebody who said she conceived twins, like she was just taking it for her skin and everything. Next thing, she got pregnant.
It may not be because of that.
But there are
Because I know
cases with-
vitamin E
Yes.
is more specific for
Skin,
skin
yeah.
and libido as well.
And so maybe because the libido now
Maybe.
is now making the thing enter.
Uh-huh.
So vitamin E is your friend. But don't go and do the enter one chance. So
Don't be like.
and she also said looking good. Thank you so much. What are the causes of pain when having sex with your partner?
Oh yeah.
I am married and I don't have kids yet.
Yeah. It might be cervical issue. Maybe a cervical issue or a vaginal issue. I know it's part of what we ask patients when we clock them.
Okay.
Do you have painful sexual intercourse?
Okay.
I think a great deal of it, I think, may have to do with your cervix or your vagina somewhere.
Okay.
Yeah, I don't really know much about.
Okay.
But I think it has to do with your cervix or your muscles or something.
There's something that people I saw on the internet recently, vaginismus
Vaginismus.
where the thing is closed.
It's-
Like,
yeah.
So
Yes.
that might be a thing.
Mm,
Or it might be psychological.
that too.
Yeah, it might be
That
psychological
too.
because
That too.
were you raped or were you abused?
Mhm.
Do you have like fear? You know, this irrational fear
Yes.
of like sex. Some people have it. Some people have
Even when they are married.
even when you're married, especially from past experiences and or maybe people are just sometimes the way we've made sex seem so bad, right? In churches, in mosques, in all the religions, if you do like this, you can't talk about sex. So people who have grown up over religious
Fear.
and shielded with the fear, when you're now put in front, because they
They're
won't tell you marriage counseling, they'll just say give your husband food. When you finish giving food on the table, give him food.
Give him
in the other room. Then time to give food now. They're like, okay, what is supposed to happen here? Do you understand? So like I get it why, but
Yeah.
so for what you said, it might be psychological, it might be physical, all those things. And so either you see an OBGYN or you see a sex therapist.
Yeah.
I recommend, I always recommend sex therapy because people don't understand that
They don't do.
there's so much resources that we have. We've grown up in so much shame culture
Yeah.
that we don't realize that there are so many things you can seek help for. So please, if you can't seek help for the issue. Okay, this person says, I would like to know how someone can increase low progesterone. Progesterone, okay.
Okay. Yeah, there are a lot of progesterone medication, like both drugs and injections.
Okay.
But I'm curious as to why she needs to increase her progesterone, because progesterone is a hormone that takes place after you get pregnant.
Okay.
It's a hormone that is more necessary after you get pregnant.
Okay.
The hormones that are more necessary before is FSH and LH, that's the follicle stimulating hormone and luteinizing hormone.
Okay.
Those are the ones that help you do your ovulation and all that.
Okay.
Is when you don't. So progesterone is produced by, like for instance, if you have your period and you don't get pregnant, right? That's when progesterone is high because your body has readied itself for the pregnancy.
Yes. Okay.
Right. So all that egg that was not fertilized, that's what we call copious luteum. I don't want to speak too much.
Yes,
big language.
yeah.
What we call copious is what produces progesterone, right?
Okay.
So that is what takes place most likely that's what prepares your body for the pregnancy, right? And it's more, to me, it's a bit more important after you get pregnant. But it also helps with building your endometrium, getting your womb ready.
Okay.
It's also important in getting your womb ready. But there are drugs and there are injections.
Drugs and injections that you can take. Okay. And she said she has
But
also,
with doctor's recommendation.
please, doctors,
Yeah.
please. I also had HSG done, and I was diagnosed with blocked tubes and was advised to go for hydrotubation, which I did.
Yeah.
How effective is it?
It depends. I think that one will depend on the doctor you see. If the doctor is good.
Okay.
Hydrotubation, I think that's when they clear it, they open the tube there. But they also need to find the cause of the blockage.
Yes.
So it doesn't reoccur.
Okay, so what's the cause of the blockage? Yes.
So it doesn't reoccur. But if the only way to know if the hydrotubation has worked properly is if you do another HSG.
Okay.
To show that. So I heard. So I heard is if you do another HSG to now be sure that it's now open properly. Yeah.
Wow. Okay. So my final question generally is, why do you think there is a stigma per se towards IVF and I won't say artificial, let me say assisted. I like to say assisted pregnancy or parenthood. And why do you think people shy away from it? Is it because it's expensive? Is it that expensive? And what are the issues?
See, the thing, if I want to discuss this particular one, but I mean, people shy away from it because of the way our country is, and also because there's that pressure. Once you marry, the next thing is to born, right? And a lot of people see it as artificial. There are still a lot of unanswered. Some people have a lot of unanswered questions, and some is like, oh, does it work? It doesn't work. It works sometimes. It doesn't. And also it's like, your child be normal.
Yeah.
Of course your child be normal.
Yeah. So it's a lot of ignorance. Yeah, it's a lot of ignorance.
A lot of ignorance. There's a lot of ignorance around the subject. That's why there's also some sort of stigma. And because I think it's also a flow through of the stigma of infertility.
That's another thing too.
Right?
Yeah.
It's a flow through from the stigma of, oh, you've not even had child yet.
Yeah, exactly.
And then you now want to go and be doing this, it's just, and it's just, I think it's just our country. A lot of ignorance.
And do you think that, in your experience, is it more women or men that are dealing with infertility? I know that you can't generally answer because but the reason I'm asking this question is because anytime they call for prayer for fruit of the womb in church, women they call. Anytime they say, oh, this one barren is women. Anytime they say, oh, you cannot give children, yet the one is a woman.
Yes.
But more and more, we are finding that a lot of men deal with infertility, sperm count issues, and all of these things.
Yes.
So
and statistically speaking, right, the problems are shared both ways.
Okay.
I think is there's a certain portion for men infertility.
Yeah.
There's a certain portion for female infertility, and there's a certain portion for combined.
Okay.
Then there's also a certain portion for idiopathic. Idiopathic does everything seems fine, but it's not happening, right? But I can tell you specifically that if, let me say, 10 couples coming here, maybe 2, the cause is from the woman, 2, the cause is from the man, then the rest is both of them combined and idiopathic. So men share equal. Do you understand? Equal issues. Equal responsibility. It's equally shared between man and woman. It's not always the woman, but it's always the woman that seeks for help. Because she's the one that carrying the baby, and she's the one that receives more of the pressure.
I get it. Okay. So is there any reason for infertility? I know that we've heard as kids and as young adults that, oh, because you had 10 abortions, or because you did like this, or you know those kinds of stigmas that okay, this is why you can't have children anymore or something. Maybe some, I don't know. I know there's so many superstitions as well towards that too. But do you think there are any things that cause infertility that can be prevented? Maybe.
Yes, now, like you said, if you've had numerous abortions, and especially if you've done them with people that are not, that didn't do them well, definitely you will have issues.
Okay.
Because they are tampering with what is supposed to carry a child, and there are different, like call them crap. A lot of quack doctors that just do them carelessly, and then the ones that can do it properly don't do because of their beliefs, right? Okay. So you go to those, and then they just do rubbish, and some of them end up hurting your womb. Or, But if you talk of causes, there are a lot of even infection too, right? Infection, STIs, STIs can go and block things. Wow. Even some can even be surgery. Wow. Some might have had surgeries that they might have to remove their ovaries or something, or maybe they must have done like a fibroid surgery, and then the womb is now affected from the surgery, maybe scarring from the surgery. A lot
my
of
mom,
things.
let me give you guys a story. My mom, thankfully, she had all her kids when this happened. Her contraception back in the day, the copper wire.
Yes, IUCD.
To her, clung to her womb and somehow miss her bowel or something, now cause an obstruction. They have to remove everything. And they now do like a bowel resection and everything. So imagine if she had not had kids at that time. So there are so many reasons why these things happen. A lot of it might not be your fault or your whatever.
Some of it may be your fault, some of it may not be.
And like the STI you're talking about, I don't know if it was gonorrhea or which one. There's a popular YouTuber I used to watch back in the day, and she opened up about it, how her boyfriend gave her this thing she didn't know. He didn't tell her and everything, and she got married, was able to have a child, the first child. But after that, now what's happening? 10 years later, she knows someone. Like she was trying till she went, and he now said, "Oh, you have this, and because of that, they blocked the hole, they done this thing, blah blah blah." And she now had to do IVF. I think it was IVF or it was IVF to carry the baby and stuff. So sometimes these are the things that happen. So I know that some of you are expecting like professional, doctor speak and lingo, but she has done her best. Again, this is my friend Emike, an embryologist here in Port Harcourt. I'll put the name of her hospital where she works, Nisa Prime. I'll put the name in the description box. I'll put the information that you need and a contact number if you want to speak to someone for consultation if you're in Port Harcourt. But if you're not in Port Harcourt, they also have a sister
in Abuja. But you can also still call. We have patients from everywhere.
Yes, okay. So just and she's a fine babe, so she can handle your matter. Okay, thank you guys so much for watching. Thank you, Emike, for coming to the channel. I hope this was good for you guys, and I'll see you guys in my next one. Okay, thank you so much. Bye.